Navy Yard area. I believe a couple of the United Way panelists are also in the area, and we'll find out when we get to the introductions. So we're going to go ahead and get started. So I'm Greta Martinez. I'm part of the innovation strategist team at IdeaScale. I'm very excited today to be hosting our webinar with United Way Worldwide Innovation Team. Previously, before joining IdeaScale, I was part of the United Way family, still am honorable member out of Miami-Dade County. And I was lucky enough to work with some of the people on the team here today. And part of our journey together was crowdsourcing. Crowdsourcing for the first time at United Way in Miami-Dade County for us, and engaging donors, volunteers in this new digital way. So today we're going to hear a little bit about crowdsourcing itself, how the innovation team leverages crowdsourcing with IdeaScale within their network and in communities at large. Specifically today, though, we're here to hear about how the innovation team rolled their sleeves up, quite literally, during the height of the pandemic and decided to start scanning, communities, start asking questions of what kinds of problems are you seeing on the ground that have not necessarily made it to the news cycle yet, right? So what kinds of problems are you experiencing that maybe we're not hearing about, publicly, but that are very much so affecting your everyday life? So the team set out to start gathering, start capturing through crowdsourcing those kinds of invisible problems before they surfaced, right? Before they surfaced to the general news media. And from there, actually engaged several partners to be able to address some of those challenges that people were seeing. And so with that, I'm going to hand it over to the United Way team. Just a couple of housekeeping items. There will be a Q&A section, a couple of 10 to 15 minutes towards the end. So feel free to put your questions in the chat. If you do put your questions in the chat, make sure that it's to everyone, not just to one person. I'm guilty of that way too many times, messaging one person with a question. That way we'll be able to capture it and make sure that we get to it. Thank you so much.
Awesome. Thank you so much, Greta. As Greta mentioned, we are the innovation team at United Way Worldwide. And Pauline, if you could advance a couple slides. Today on the panel, you have myself. I'm Edwin Gauthier, the Vice President of Innovation, Pauline Ng, the Innovation Specialist, Megan Trace, Director for Social Innovation, and Lynn Taveskov, the Senior Manager of Innovation. Together, we're United Way Worldwide's innovation team, and we also lead thought leadership for social innovation as the Center for Social Innovation at United Way, a partnership between the Barnes Family Foundation and United Way Worldwide. So we're going to get into a little bit of the agenda for today. We're going to make sure that we leave a lot of time for Q&A at the end. But first, we're just going to tell you a little bit about United Way and our worldwide movement. And then next, we're going to tell you a bit about the context for the Invisible Problems campaign, and then go into the phases of our crowdsourcing and solution development journey. You can go ahead to the next slide, Pauline. So about United Way. United Way's mission is to mobilize the caring power of communities to improve lives around the world. Our vision, we envision a world where all individuals and families achieve their basic human potential through education, income stability, and healthy lives. A big piece of our recent change, it's also included a focus on equity and inclusion. In the United States, a very big focus on race equity, and around the world, equity around different ethnicities. As I mentioned, we're a worldwide organization with, we're active in 40 countries. 1,200 communities have their own United Way organization. 1,000 of those are just in the United States alone. And so whether you're in Calgary or Cape Town or Miami or Mumbai, you have a local United Way that you can turn to whenever you need it. And that locality, that hyper-local nature of our network is really the core of our superpowers. So one, we know the issues in our local communities. We have that deep understanding where we can tackle the root causes and not just focus on the surface level of the issue. Three is we bring people and organizations together to solve problems. That goes across sectors, including government, nonprofits, corporations, and just everyday citizens who are interested in making a difference. And then four, we're hyper-local, but we have that ability to scale our impact around that world through our incredible network of local United Ways. So I want you to keep some of those superpowers in mind as we talk about the Invisible Problems campaign. We're going to start just by talking about where it came from and the genesis for the project. So I'm going to take you back to April of 2020. If you would remember that time, we were all understanding what the pandemic was going to be like. We were probably 2 or 3 weeks into working from home and wondering if this was really going to go another 2 or 3 weeks. Some of us were learning to be our child's teacher or how to homeschool our kids. But during this time, I had a conversation with an acquaintance who, during our conversation, his phone kept blowing up. And when I asked him what was going on, he told me he is a volunteer with Alcoholics Anonymous. And for Alcoholics Anonymous, they were being kicked out of all of the churches and places of worship where they normally hold their meetings. And he was telling me he was really worried about the newcomers to his Alcoholics Anonymous group because they wouldn't have somewhere safe to go to make sure that they didn't relapse and go back into bad patterns. And from that understanding that even our best actions during the pandemic would still lead to bigger challenges, it became clear that we would have to be thinking about what problems might lie beneath the surface of the pandemic. And so we were all very well aware of the millions of confirmed cases and the unemployment claims, but we started to see more and more that there were things lying beneath the surface, like canceled graduation and other milestones for youth, the challenges with remote access to class. There was a story in Miami-Dade that said only 75% of students had even logged in to the remote learning environment by May of last year. And so we were tracking some of these issues, but knew that there was an opportunity for us as an innovation team to do more than just keep an eye on it. And so with this campaign, we had the opportunity to, one, to crowdsource those problems, and two, to actually put together solutions. An example of an early invisible problem that came to our attention, we had 3 submissions in our crowdsourcing platform in IdeaScale that were just about people being worried they wouldn't be able to vote safely. It was a big, important election in the United States, and we wanted to make sure that people had access to the ability to vote. And so we actually partnered with a nonprofit technology startup called Vote America. And they had created this pretty incredible solution that made it really easy for people to access their vote by mail and voter registration. And so through that partnership, even if a local election office required someone to fax in their voter registration, and that is a real thing, there are local election offices that require you to fax in your voter registration, they created a technology solution that let people send a fax from their cell phone, even letting them electronically sign their voter registration. And so with that ability, we were able to recruit Vote America as a partner and bring their technology tools to voters in the United States, so they had the ability to vote safely. With that, we knew there were opportunities for us to learn and to continue to grow the number of problems that we were sourcing and the number of solutions we were able to create. And so we created this process for what we would do as we source problems. In the beginning, we're out in the general public asking people for their feedback. We created a number of ways people could submit their problems to us, including on the IdeaScale platform, through forms, and we use the API to get all the content in those forms back into IdeaScale automatically. Then we tagged the different problems that came in so that we had a sense of what people were talking about, what were the themes of the issues, whether it was different populations that were being affected or the causes that were being impacted. We then prioritized the issues that came in based on what we thought we could actually accomplish at United Way Worldwide and what seemed urgent and important in that moment. Then we ideated on solutions, and we're moving into a new stage now where we're actually testing more of those solutions out in market. You can continue. Now, as you saw in that first slide, nothing that we do at United Way is done alone. So we had some incredible partners in this work. iHeartRadio ran a series of concerts last year and directed people to submit their invisible problems to United Way. It was a great ask that we could make of the general public. That wasn't just about donating money to the COVID fund, but was really about getting people involved and sharing their intelligence with us. Ally Financial and the Barnes Family Foundation were both funders of this work, and we're so grateful for them for the resources they were able to provide. At Deloitte, you'll hear more about their involvement shortly. They were the incredible partners that are helping us in the ideation and testing phase. And finally, IdeaScale, the platform was super clutch for us throughout, but even more so the guidance and the strategy support that we received from that team really helped this project come to life. So this is just a brief view of the timeline of the campaign. We started with problem sourcing in the late summer of last year. We were really trying to find solutions to some of the early issues that came in at the early summer, but then continued to do that innovation in partnership with Deloitte through Q2 of this year. We are entering now the testing phase, which we're incredibly excited about. And finally, we're going to be doing some evaluation to close out this year to make sure we're really sharp about how we approach these types of problem crowdsourcing campaigns in the future.
Perfect. Thanks, Edwin. So as Edwin mentioned before, we were trying to surface all these invisible problems people were facing. And so we utilized IdeaScale, where users could easily submit a problem, as well as offer potential solutions to their problem or other problems on the platform. And so at first we asked colleagues, friends, and family, but we really wanted to reach a larger audience. And so we utilized Facebook ads. We ran these ads in 2 languages, English and Spanish. And we asked them these 2 questions. Number 1, what was the problem they were facing? And number 2, if this problem affected a specific community. We also allowed folks to submit their problems anonymously, just because sometimes it could be a very sensitive topic. And so we targeted these ads towards individuals living in states with the highest COVID rates at the time, as well as communities of color and frontline workers. We wanted to maximize the ad performance. And so we conducted A/B testing just to compare factors like the headline, the body text, the image, and as well as the format. And so we quickly realized that the most successful version is what you see to your left right here, which was a form that allowed people to directly share their problem on the ad. And this showed the highest conversion rate. And it's probably just because there was just less barriers for the user experience, where they didn't have to create an account and do XYZ. And thankfully, using IdeaScale's API, submissions were automatically added into IdeaScale to just really streamline the process. So we ran these ads for around a month. And after that, we received around 200 problems. These problems ranged from a variety of issues. We saw a lot around difficulty paying rent, getting groceries, especially for senior citizens, mental health issues, isolation, loneliness, as well as concern for distance learning for children. So I'll pass it on to Megan.
Thanks, Pauline. So after we received the more than 200 really important invisible problems, we were fortunate to team up with Deloitte to be able to move into that solutioning stage together and tap the minds and expertise of a group of corporate volunteers to help us craft solutions to some of the top problems that bubbled up. So I'm going to share about that joint endeavor, which we called the Designathon, and also where we went with this after. So next, please. So I'll outline the core components of the Designathon, but at a high level, the basic idea of the Designathon was that teams were going to group up, tackle one of these invisible problems that came in, craft a solution, and pitch their heart out, as we said, to a team of judges who then would select a winning solution, which we, the United Way Innovation Team, would move forward to test. So that was the basic idea. And all that really happened within a 2-week window. So what made it work? We prioritized issues that had come in through the Invisible Problems campaign. We had some support in researching from Deloitte and upvoting top issues. We applied our impact lens and kind of this juncture in the pandemic where we're at in terms of what would be salient to work on moving forward in some of these more lasting recovery-oriented problems. We identified 6 issues ultimately, and then teams of Deloitte practitioners came together and volunteered to form a solution team and identified a leader and members, and then through that answered a series of questions on IdeaScale. So we're able to use IdeaScale for most all of the outward-facing components of the Designathon. And so we had 8 questions where they submitted some core responses about who their customer was, or the beneficiary, what the equity impact would be, what the potential for scale would be, lots of details about their social innovation, and then the details around the pitch. So what would it be for a 6 to 7 minute pitch in front of judges? And so through that, we also provided training. So we did a kickoff where provided design thinking training centered in equity, and another touch point for the teams to provide coaching and technical assistance as they started to work on their solutions. And we found that that extra touch point was really helpful just to keep folks on track and support them through the solutioning. Concurrently, we recruited judges who were primarily leadership at Deloitte, as well as leadership from the United Way Network on the impact side. And we had set out a weighted criteria for evaluating solutions, which was known to everyone. So they knew how they would be judged, and then ultimately culminated in a virtual pitch session where we had 3 teams present their solutions and picked one winner. And supporting all of these core elements were consistent communications, really reminding of the schedule, the deadlines, and then supporting on the platform navigation piece because IdeaScale was such a big part of the Designathon. Next. And this just gives you a little bit of a snapshot. I mentioned all this happened really within a month. And so we had about a 2-week recruitment window, and then a Designathon kickoff, which was that design thinking training. They had about a week and a half to work and upload everything. And then the pitch session occurred 2 weeks after kickoff. And we announced the winners really quickly, actually within 2 days. So it was nice that we were able to keep it tight and keep folks engaged through that window. So just give you a sense of what's possible within this period of time. Next. As I mentioned, IdeaScale was really our one-stop shop for the user-facing functions, and we were particularly excited to be able to use the review scale functionality, where the judges could actually go into the portal and rate the solutions there. So the responses to the questions lived in IdeaScale, the teams teamed up on IdeaScale. They uploaded their pitch decks, the judging was happening there, the winning solution was identified. So it was just really a full service hub for us. Next. And then to give you a sense of what these solutions were that the Deloitte teams came up with, Pauline mentioned some of the themes of the invisible problems that came in. And so one solution was around a public health awareness campaign, really about social activity, knowing that a lot of youth had been isolated and it was having concerning effects for long-term mental health. And so that was one solution a team envisioned. The grocery delivery was really fascinating. I liked this invisible problem a lot because it came in from a grocery store employee in Ohio who had just the phone was ringing off the hook for their grocery store from seniors who wanted to place phone orders for groceries because they didn't necessarily have access to Instacart or know how to place online orders and all that. And so the grocery store employee was distraught that they couldn't help this population because they weren't set up to do phone orders. And so a group from Deloitte tackled it and came up with an idea around working with senior living centers and figuring out whether a catalog approach of kind of weekly ordering could be a solution for that. And so we thought that was a really creative solution for a tech issue. And then the winning solution was actually unanimous, was around tutoring fourth graders in literacy through a program solution called Literacy Leap. And so this was really in response to the growing disparities that were exacerbated during the pandemic, where communities of color and lower income students have a greater learning gap, literacy gap, in a critical juncture when it's the transition when students are learning how to read and then reading to learn. So that's like that third and fourth grade timing. And so they designed a solution to create a platform that would match volunteers with students to improve literacy scores. But one distinguishing factor was that it would recruit high school and college youth who were aspiring teachers and actually train them in literacy skills and coaching, so that way they would be able to provide more specialized supports to youth during this critical window, and then have a matching capability. And so we're excited now to move into testing. So Pauline, you can move to the last slide here. So next week we kick off a 2-month sprint to test this Literacy Leap solution. And we've developed a business model canvas around what the solution could be. And so we are seeking to identify really all the customers, because we think about what this would be. It's students, it's parents, it's teachers, it's principals, it's school administration, volunteers in high schools and colleges, funders like United Way. Who are all of the customers? What's our value proposition for this? And what are our riskiest assumptions if we are going to launch this program? And so I think this is a different approach that the innovation team is taking. Prior approaches might be with the United Way that we're going to pilot something and we're going to deploy a cadre of resources and train volunteers and just go ahead and execute this for a year. But before we do that, we want to learn as much as we can to de-risk this solution. And so that is what the next 2 months will bring. And then we will learn whether this is viable, whether this is desirable, and that there's a market for this, and what customers are really interested in this. So that's the next phase. And we're really excited to launch that next week. So I'm going to turn it over to Lynn now.
Thanks, Meg. I'm going to rush through the last portion of this so we can get to our Q&A. I want to give you some advice that we documented from our experience, and it's also captured in a case study that we wrote up about the Invisible Problems campaign that you can download. We've got a link at the end. So, before I get to advice, I have 2 slides that break all the rules of a good PowerPoint presentation. I'm not going to go through them, but that we're providing them to you as a reference for those of you who work behind the scenes on IdeaScale on the platform. These are the 2 funnels and the functional stages that we used for the 2 campaigns. So I'm not going to go through them, but I wanted to provide you with those details, because I know when I go to an IdeaScale webinar, I always want to know, how did they do that? What functionality did they use? So these 2 slides are here for your reference. And I'm going to go into some of the advice and lessons learned. It's a great idea to line up partners from the start to help solve people's problems. People were sharing a lot of issues that weren't right for the specific topic of the campaign. And it would have been great to have partners in place to hand these folks off to. You saw that we have a number of stakeholders who were involved, and we were relentlessly focused on providing a great experience for everybody who was involved, to meet them where they were, deliver high quality content, and provide support at the various stages of the user journey. As Pauline mentioned, build in time for that A/B testing of ads and the ad approval process. Design for mobile and make sure your content, especially images, will grab and hold someone's attention long enough to convert them. Create and implement a communications plan for the Designathon. Pauline spent a lot of time working on that and adjusting in real time. Recruit the necessary cross-functional team at the beginning. We were designing at the same time as we were implementing, and we were able to recruit cross-functional teams internally and externally, and recruit on the fly, but it's great to have that in place ahead of time. And finally, over-recruit and diversify your Designathon judges. We recruited 6, 5 of them were able to come, and reflecting on their backgrounds, we would recommend subject matter expertise, high business acumen, and a strong entrepreneurial or startup background. I also want to say thank you again to our sponsors and partners, and to Greta, our innovation strategist, and the unsung heroes, the IdeaScale support staff, who were responding all the time to our problems and questions as we were setting this all up in real time. So we're going to open it up for Q&A, and we have some links for you as well. You can download the case study, and if you want to reach out to us for how to bring a social innovation challenge, and if you want to support our work, there's a bunch of links there. But we'll turn it back over to Greta for questions.
Thank you, Lynn, Edwin, Megan, and Pauline. I have so many questions. I'm going to go ahead and open the floor up. If anybody, would like to either put their question in the chat, you can do that now, or you can just unmute yourself and go ahead and bring it up as well. Okay, so it looks like we have a question here in Q&A. So the question's asking, what were some of the most common questions that came up in the Designathon office hours that you held?
We found that the office hours, it was really helpful to make sure the foundations were in place in terms of having the teams really clarify who they were designing for. And so that beneficiary identification, I think a lot of the visible problems came in, and they were really broad, and they could have really gone in a lot of directions in terms of the approach to solve and what specific element of the problem they wanted to solve for. So helping them clarify the problem they were solving, and especially who they were solving for. And we found that teams came to the office hours and said, we're going to craft a solution for students. Well, that's a very general population. So it's the difference between saying our solution's for students or our solution is for ESL high school youth from rural areas who lack consistent access to broadband at home. So really helping to narrow it in means you're designing for something that's much clearer and able to understand the pains that your customers experience and how you might help them alleviate those. And so that was one piece. And then Another theme in the office hours was really around equity and helping the teams understand how to design with that equity lens and think through how is this going to specifically help communities of color. What elements are you adding in for ensuring equity is a really important piece of your impact.
Thank you, Megan. And I'm curious, have you engaged with other individuals in this type of design thinking, problem sourcing, Designathon as you did in the office hours?
You want to jump in there, Edwin?
Yeah, absolutely. So the Designathon, that model is new, and we're so grateful for Deloitte for so many reasons, but one of the big reasons is that they're always willing to experiment with us. And so they partnered with us in almost co-designing the Designathon as we were delivering it to their employees. But crowdsourcing in general is not new to United Way. I mean, as you know, you were part of the pilot of United Ways who tested crowdsourcing in their communities. And for the last few years, we have a crowdsourcing platform that's available within our network. So able to crowdsource ideas from United Way employees. But right now we're really also very interested in seeing how we can partner with United Ways on the use of the internal platform and for the external platform for things that are like invisible problems.
Great. Thank you for that. We have a question from Laura. Thank you, Laura. And I'm actually going to give you the opportunity if you'd like to go ahead and just ask your question yourself, if you're able to. Okay, so I'm just going to read it out here. Did your team leader and members know one another prior to the Designathon? I'm curious if there's value in the team knowing one another versus getting to know one another at the kickoff event. We are thinking of doing Designathon or IdeaScale with volunteers from our emerging leaders group with leadership from our board.
So commenting on the second part first, yes, you should definitely do it. And you, Laura, I would love to partner with you all to make sure any support our team can provide, any wisdom, lessons learned, battle scars, that we can give that to you up front. And no, our team leaders and members of the from Deloitte, they didn't actually know each other before they signed on. So it was an office of about 1,500 people that were participating. We gave people the opportunity to sign up for the invisible problem that they felt most passionate about. And at the end of the Designathon, we actually asked if the Designathon was helpful in participants meeting new people, and they said yes. So it had that extra employee engagement and making connections during the pandemic piece that I don't even think we would have thought of had we not have delivered the Designathon.
Thank you, Edwin. And Laura, I think you're able to unmute now.
Yes.
Do you want to give it a sorry about that.
That's okay. Yeah, thank you so much. We've been tossing around the idea of doing an IdeaScale based on, I think it was a couple of years ago now that the innovation team shared, I think maybe it had a different name, IdeaScale, not Designathon. So we're interested in learning kind of the difference and how this is, you know, unique, the approach that you took this year. It sounds like you had so much support technologically speaking, and we have a great team here in Fargo-Moorhead with our Microsoft campus, and they do hackathons all the time. So we're really excited to connect with you and learn more because we would definitely like to execute an event next year.
Can't wait. Thank you, Laura.
Thank you.
And thank you, Dr. Nasser, for your comment. I completely agree. I think one thing that's particularly fascinating about your campaign is that you're able to bring together so many different types of partners from, perhaps, Deloitte corporate, private partner, as well as iHeartRadio. It sounds like even in specific communities, through the crowdsourcing campaign, you were able to develop relationships, engage people that perhaps otherwise would have not been touched by the network, right? By the social services that could make a difference in their everyday lives. So completely agree with you there, Dr. Nasser. I think we have another question here from Dr. Nasser, who's asking, what is your next project? Your next jump?
Well, the next project for us is testing the solution we got from the Designathon. So that Literacy Leap, the Literacy Leap pilot, or I'm sorry, the Literacy Leap solution that we talked about at the end of the presentation. We will be testing that over the next 2 months. Beyond that, we're looking forward to 2022, an exciting year where we'd be able to really focus this attention and effort in partnership with United Ways. The one thing that was really difficult during the pandemic when we have to move so quickly is that you don't have the chance to really bring people along the way that you would like to, but these opportunities to work with folks like Laura and innovators across the United Way network is going to be a huge opportunity for us in 2022.
Thank you, Edwin. And seems like previously you were unable to unmute. This is for the audience. You're able to go ahead and unmute and ask questions now. Apologies about that. We do have another question that came in. I want to make sure we address it as well. What lessons did you learn from your previous crowdsourcing campaign that you applied to this campaign? So
I can take that one. First is to use fun and human language. Don't stand on formality. Communicate with people like it's a friend sitting across from you. And secondly, remove as many barriers as possible to get people to participate on the platform. I mean, if we have to upload and create accounts for people, we'll do it. So make it as easy as possible for people to participate. I'd say those are 2 main lessons.
thank
I
you,
have a
Lynn.
follow-up question to that, Greta. This is Laura. I'm curious what the IdeaScale platform offered in terms of lowering the barriers to participation. Obviously, I'm assuming it offered so much in terms of being able to scale and execute quickly. But what do you think that offered in terms of making it accessible to more individuals?
Yeah, absolutely. I would say on the Designathon side, it was incredibly helpful because we're introducing a technology product to a workplace, and we all have, our sticky notes with 5, 6, 7 passwords. But I think what's great about IdeaScale is that it provided so much value, having everything in one place, from the resources that they can look to previous recordings of webinars and trainings we provided. Literally everything was on IdeaScale for the participants who are consultants who in their day job and are just doing this out of the goodness of their heart, and incredibly busy people. So being able to use IdeaScale as the hub for all of the activity that happened in the campaign was hugely important. But for the crowdsourcing problems part of the campaign, we're thinking of a different population potentially. So Pauline mentioned we are targeting people who are in high-risk COVID areas, who are frontline workers. And so the idea of creating a login just so they could submit a problem, we thought it didn't really make sense for that user's journey. So instead of forcing them to go into the IdeaScale platform, we just use the tools in IdeaScale, like the API and their batch upload feature, to capture problems from wherever someone was willing to send them to us, forms, Facebook ads, anywhere, and then get them automatically into the IdeaScale platform. So it wasn't really about using IdeaScale only, it was really about creating a user-centric journey, and then making sure that we were delivering that in a way that our participants really loved.
Thank you, Laura, for your follow-up question. We also have another question here. Thank you, everyone, for participating and engaging. How long has United Way had an innovation team? Very good question. Curious about that history and would appreciate any talking points to convince my organization to develop the same. I hear you. I know you submitted anonymously, but we hear you.
That's awesome. So the innovation team at United Way was started in 2014. We were initially created almost like a startup incubator for very important strategic initiatives, which was great because we got to work on big, meaty problems. But it was also not great in that it kind of forced us to be in that old school mentality of you're given a bunch of resources, you have to execute well, which is not really what you think of when you think of a lean approach to innovation, testing, understanding market needs, going in lean before you invest big. And so our team has just grown recently thanks to investment from the Barnes Family Foundation. And with the incredible people that you see around me, we're shifting our focus of our team and will be more like that agile, lean testing approach that Megan mentioned in her presentation from this point forward. Oh, and as far as showing the value to organizational leaders, you know, I would love to have a conversation offline. Greta, feel free if you know, we'll put my contact info in the chat or something. But I think the biggest opportunity is the investment in innovation doesn't have to be huge for it to have huge long-term benefit. You have to come in with a different idea of what success looks like, of what your expectations are for what the team's going to deliver. But starting small with an innovation team and just having that lean approach to doing something different is really all that's required. And so good luck on your journey, and we're here to help if we can in any way.
Thank you so much for your question. If you're able to share, I'd be curious to know if you are reaching out from also a nonprofit organization. Again, you know, United Way Network has been driving innovation as a strategic, you know, prioritization for the organization since 2014. But we also see other nonprofits that don't necessarily have, you know, the reach, the resources, be it financial, human capital, as the United Way Network, smaller organizations that have also been able to leverage crowdsourcing, you know, with IdeaScale, also through other engagements that have been able to, I would say in your value proposition, think about how innovation, everyone at your organization is a resource, right? Everyone in the organization is a resource when you're asking them to think about problems that they see in their everyday work, or perhaps for their customers, their clients, what kind of problems are they seeing? How can we help solve them? And actually to that point, to the United Way team, it's interesting that we're seeing quite a lot of these hybrid problem and solution sourcing innovation campaigns. And this is industry agnostic. We recently had the New York City Department of Small Business Services, very, very similar to your initiative around March, actually, of 2020. They came to us and they said, we really need to start, we want to start sourcing the problems that restaurant and storefront business owners are experiencing because of COVID-19. Now, this is New York City, so you can imagine just the kind of impact and really the reach that you could have when you have a platform allowing any restaurant owner, any storefront business owner to come in and say, this is my problem right now. You know, I have you know, no access to a digital tool, for example, that could potentially help me be able to sell services virtually. Business owners not having websites, for example, right? Something as perhaps innocuous, we think, well, everybody has a website now. Well, that was a kind of problem that surfaced. And they actually had the same structure as you as well, where they had a problem sensing campaign, and then they had the solution sourcing campaign separately. So I wanted to share that, and I'm curious if anybody else in the audience has thought of perhaps doing this type of innovation campaign where you're separating the problem sensing from the solution sourcing. If you haven't, are you interested in doing something like that? I mean, I think right now with the pandemic, it presents a unique opportunity to be able to ask people, whether it's your customers, your citizens, your community, what kinds of problems are you facing? And then perhaps even giving them the opportunity to provide solutions themselves.
This is Laura again. I guess I can share that what you've just described in terms of having the participants and community members and partners also participate in creating the problem list. I think that that extends what I know our team had originally talked about and makes it even more impactful to allow the community to help identify the issues collaboratively, as well as pursue those solutions in the Designathon. So I really love the kind of A to Z approach with that, because we had assumed we would be giving our groups the problem and asking them to pitch solutions. So I love it. I think it's a much broader approach, and obviously will be more impactful for participants.
Thank you, Ariel, for your question. My question is that this takes time. So this is in the chat. I believe everybody can see it. Separating the problem sensing from solutions. How do we enroll fast-paced teams, organizations in taking this time? Great question, Ariel. Thank you. And I think, Edwin, you unmuted yourself, so I'll let you go ahead if you want to.
No, it's a great thought, and an important question that I wrestled with last year as we were sourcing solutions and didn't have the resources lined up at that time to solve them. And it was just a concern that we were going to miss the window, miss the opportunity to actually provide value to folks who were in need at that time. So it would be possible because the platform is super dynamic and allows for lots of things to happen at the same time, for you to run those two campaigns simultaneously. So you can run the problem sensing campaign, and you can have groups of people who have already raised their hands as volunteers to be ready to hop onto problems, and you escalate a problem maybe once a week for that group to tackle. It's totally doable. You just have to have all of the resources lined up from the beginning. Again, that was not not the environment that we were working in last year in the height of the pandemic, but it's a great question, and I think if you're able to have that those two things running concurrently, it could be a great way to show value to stakeholders as you create small wins at the very beginning of your campaign.
Yeah, I completely agree with you there, Edwin. And Ariel, thank you for your question. In the New York City case study, they actually had exactly Edwin's setup in the platform. So they had both campaigns running concurrently. They actually had different types of questions. So of course, one of them was problem oriented. So you're asking, how can we help solve XYZ? Or what is your problem they're experiencing? And then the latter is, how can you help us solve this problem? So they were actually funneling in the platform problems received towards that solution campaign in real time. And so I think that's typically that would happen, if you're not using some kind of digital tool or the platform itself, that could take many meetings, capturing, on Excel, which we absolutely don't want. So thankfully, the team was able to leverage that functionality and say, we want to have both of these running concurrently. Oh, I think we have one more question here. Great question. Can you talk a bit more about how you arrived at the KPIs to measure impact and efficacy of the solutions you've deployed?
Yeah, absolutely. So one of the great things about United Way is that our work is so broad. It covers education, financial stability, and healthcare. One of the challenges is it's not always easy to have those top line metrics that are just easy to report. We're not a charity water where we just say X number of people have access to water now that didn't. And so we don't have top line metrics for solutions in general. But as we go into this testing phase for the literacy solution that we are piloting, part of that process is understanding what our KPIs should be. Does it create literacy results that are better than the current alternatives? Is there an actual sustainable business model for this product? And so in our testing phase, the very first thing we did was list out assumptions, challenges, and risks. And that's what's going to drive a lot of the KPIs as we go through that testing. But we don't have like a high level, here's what every single solution has to be able to accomplish. We're more flexible than that, and the problems and the solutions are way more diverse.
Very good question, thank you. And I think that's a really good point, Edwin, when regardless of what industry you're in, when you're considering what metrics you need to keep in mind, whether you need to be reporting them to leadership, on a recurring basis, or just starting with the outcome in mind, is something that we always talk about and recommend for every innovation campaign that's launched on the platform. And part of that are your KPIs, right? So for example, United Way, some of you may know that the main 3 pillars are education, health, and financial stability, right? So how can we, I'm sure you have KPIs around each one of those pillars with everything that you're doing at the organization. So keeping in mind, I know for the team here, you had a question, I believe, in one of the stages that you used around that. So like what kind of pillar does this solution impact or problem impact? So keeping that in mind, even before you're also starting out with the crowdsourcing campaign, what are the kinds of things that we're going to have to measure, whether they're quantifiable or are more intangible, such as how does this idea fit with the culture of our organization? Are people going to accept this? Are people going to implement this? Or are we going to have to do a lot of change management work for that to happen? Laura had another great question around how can the United Way network access the internal IdeaScale community? And Edwin, I'll let you go ahead and let folks know how they can do that.
Yeah, absolutely. For my United Way colleagues, first of all, thank you for joining. Second, if you go to United Way online, there's an Ideas and Innovations tab, and there's a link that says United Way Idea Lab. That's how you access our internal instance of IdeaScale that you can use to submit innovative concepts. Now, we have some evergreen campaigns that are happening now, but we're also in the process of planning 2022. And Megan is taking the lead on that, but we will be coming to you with opportunities for even deeper engagement on that internal IdeaScale platform. So stay tuned. If you have any ideas or ways that we could use this, or even use the external platform, reach out to us, because we can't wait to talk to you and co-create something awesome together.
Thank you, Edwin. I want to thank the United Way Worldwide Innovation Team once again. Thank you for this incredible presentation on the really just highlighting the nexus of innovation and impact, social impact, social innovation. Yes, those terms can be used and should be used together more often. We appreciate the work that you're doing to help, everyday people's lives in every community across the world. Deeply grateful for your partnership. Thank you for everyone that attended today as well. You're going to receive the recording for today, as well as the presentation. And you'll have the team's contact information there should you want to reach out as well. And with that, we are going to conclude today's webinar. If you would like to reach out and just, this is the first time you're hearing IdeaScale and you're itching to know more what that is, feel free to reach out to myself as well. You'll have email in the follow-up. Hope everyone has a good rest of the day or evening. So we see some Cape Town folks. Take care, everyone.